So next we go on to the next speaker. We welcome Dr. Lucy Thaliath. She is from Thaliath Eye Hospital, Calicut, and she'll be speaking about the glasses which prevent progression of myopia. That is about navigating innovations, peripheral defocus lenses in myopia. Over to you, Dr. Lucy.
Good morning. Thank you, KSOS and Dr. Meena, for giving me this opportunity. My topic is peripheral defocus lenses in myopia. So why should we treat all these cases of myopia? As we all know, myopia is on the rise and is expected to affect around 50% of the population, as say so there were many studies conducted around the world, and the Indian studies also show similar findings. And once we diagnose a case of myopia, our aim should be to decrease its course, and there are various interventions to reduce the progression, and these are the interventions which are shown to have effect on the progression. This is the behavioral intervention, and here we have to increase the time spent outdoors and also decrease the screen time. And the pharmacological treatment has been already dealt with. And next is the optical treatment. And there are various theories on myopia. I'll just tell about various theories. One is the feedback mechanism, one is the contrast theory, mechanical tension theory, accommodation lag theory, and the peripheral refraction theories. And the glasses are mainly based on the peripheral refraction theory. So how does it act? And when we give a single vision glasses, the light focuses on the retina mainly in the central area. And in the peripheral areas, it has a hyperopic defocus mainly. And that is, the light will be focused behind the retina. And this acts as a stimulus for the axial length elongation. And what was it based on? It was based on various animal studies. This is a famous study by Earl Smith et al. And in his studies, he found that the visual signals from the fovea are not essential for the normal refractive development, and peripheral retina in isolation can regulate the emmetropizing responses, and peripheral hyperopic defocus is the cause for the progression of myopia. And what does it exactly do? This peripheral hyperopic defocus induces a cascade of cellular and biochemical changes in the retina, causing RPE and the choroidal changes, leading to scleral remodeling and growth, and resulting in the altered ocular growth and the refractive status of the eye. So our glasses and peripheral defocus lenses, what does it do? It converts this hyperopic defocus into a myopic defocus, and thus reducing the progression. And before treating all the cases of myopia, we should know whom not to treat. We should not treat a case of pathological myopia, a syndromic myopia, as those associated with the Stickler-Marfan syndrome, and myopia associated with glaucoma, myopia with prematurity, simple myopic astigmatism, and in a case of compound myopic astigmatism, where the cylinder power is much, much more than the spherical power. So whom should we treat? A simple myopia and a progression recorded more than 0.5 diopter, and an axial length more than 1.1 millimeter recorded over a year, with a strong family history and a young age of onset. So what are the various options available? Spectacle lenses are available in India, is widely used in India, and contact lens is not much used in India. And these are the various options available in India. One is the DIMS glasses, or the defocus incorporated multi-segment spectacle lenses. Next is the HALT glasses, that is the highly aspherical lenslet target spectacle lenses. Next is the lenses using the KI technology, or the cylindrical analog refractive elements technology. I'll just go through the glasses, and all these glasses, peripheral defocus glasses, have a central clear zone for the distance vision, and depending on the type of glasses, the central area will be different. And in DIMS glasses, which is known as the MyoSmart glasses, marketed by the Hoya group, it has a central 9 millimeters clear zone for the distance refractive correction. It is surrounded by like 400 multiple defocus segments, or each of 1.03 millimeters, and this has a plus 3.5 myopic defocus. And what does it do? It produces a simultaneous defocus both during the distance and the near viewing, and thus one plane is created on the retina and one plane is created in front of the retina, creating a myopic defocus, and these are due to the +3 defocus lenslets. And next is the lenses. It's called the Stellus glasses, marketed by the Essilor group, and here it is 9 millimeter central clear area surrounded by 11 concentric rings of aspherical lenslets, and these lenslets have plus power, and the plus power also varies according to the refractive status and also from the center to the periphery, and it produces a three-dimensional volume of defocus in front of the retina of the varying dioptric power. And next we have the glasses using the CARE technology. Here we have a central, similar to the old glasses, we have the central clear zone for the distant vision, and surrounding it we have alternating cylindrical elements for the defocus part. And it forms a these cylindrical elements forms a caustic as that we get from when light passes through a glass of water. And this caustic has an extended focus, and this causes a myopic defocus in front of the retina. And this is known as the myopia lenses, marketed by the Zeiss group. Two models available, one for the less than 9 age group and one for the more than 9 age group. And for the less than 9 age group, it is central area is 7 millimeter, and for the more than 9 age group, it is 9 millimeter central clear zone. And the power ranges for the DIMS, HALT, and the CARE technology are shown here. For the DIMS, it's like up to -10 D sphere and up to -4 D cylinder, and the HALT glasses -12 and D sphere and -4 cylinder, and the CARE technology -9 sphere and -6 cylinder power. And about the various journals, we have many studies conducted on these DIMS glasses, and DIMS have the maximum follow-up because it was the first introduced. And in the study, it was conducted in Hong Kong, and myopia has shown to be progress of 52% more slowly in those wearing the DIMS glasses compared to the single vision glass. And also the axial length elongation was less by 62% in the DIMS group. And there are various studies conducted by the DIMS glasses, all these defocus glasses, and it's around 60 to 70% slower myopia progression in most of the studies. And on the effect on the visual functions, the long-term study conducted by Lam et al. Showed that the visual function in those wearing the DIMS glasses is similar to that of the single vision glasses. And also there is no evidence of much rebound effect in those wearing the DIMS glasses. And I'll just go through the contact lenses. These are not much available in India, and there are two types. One is the soft contact lenses, which is the daytime wear lens, and the ortho K lenses, nighttime wear. And this is a table showing all the commercially available contact lenses with peripheral defocus designs. And most of the studies are on the MySide design, which has a multi-zone design contact lens, which has also demonstrated good decreased myopia progression. And ortho K lenses, as we know, the myopia is by the corneal's flattening mechanism, and also the peripheral rays by the ortho K lenses it is focused in front of the retina, causing a peripheral myopic defocus and thus decreasing the progression. And it offers around 50% myopia control effect. And so the major concerns in these lenses are at the age of starting the contact lens, the risk of the infections, and the rebound effect. And because of all these and cost factor, these are not widely used in India. So before I'll just say what and all we have to look before dispensing the glasses. We have to select a correct frame. The frame should at least roughly around, it should be from the eyebrow, or else all these segments won't be included in the glasses. And it should be not loose, not tight, and the IPD should be accurately marked, because we have only 7 to 9 millimeter of the central clear area for the distance vision. And also you should tell the parents that to make the children wear the glasses for at least 12 hours, and also not to remove them during the near work. Though there are many optical treatments available, long-term studies comparing the efficacy of each modality in Indian scenarios are necessary for the substantial results. So we have some results from the Indian studies, that is mostly from the combination treatment like DIMS and low-dose atropine. So we need to have Indian studies for that, and always remember, give the parent an option when you record a progression of myopia. All the various options you have to give the patient, and all depending on their comfort, and they can choose. Also don't forget to tell them about the cost, about the side effects of the if it is the drops, you have to tell them the side effects, and always give them the option. Thank you.
Thank you, Dr. Lucy.